Okay, section 14.1, functions of the skeletal system. If you don't have a skeleton, you'd be like a rag doll, shapeless and unable to move. Your skeleton provides support, protects many organ systems, and is a landmark for much of medical terminology. For example, the radial artery you use for taking a pulse is so named because it travels inside the radial bone on the forearm. In addition, the surface anatomy of bones and their markings enable you to describe and document the sites of symptoms, signs, and clinical, diagnostic, and therapeutic procedures. The four components of the skeletal system is 1, bones, 2, cartilage, 3, tendons, 4, ligaments. Skull consists of frontal bones like zygomatic bone, maxilla, mandible, parietal bone, temporal bone. Okay, and then the pectoral girdle consists of your clavicle and scapula. We have your thoracic cage consisting of your sternum, ribs, costal cartilages, humerus, maybe. Anyway. Okay, then you have the vertebral column, your pelvic girdle, your carpus metacarpal in your hands, ulna, radius. Okay, phalanges, the tips of your fingers. You got your femur bone going down to your patella, which is your knee, fibula, tibia, and your shin. And then, let's see, you have the tarsus and then metatarsal bones and phalanges, the tips of your toes. Okay, the bones provide the following functions. They provide support. The bones of your vertebral column, pelvis, and legs hold up your body. The jawbone supports your teeth. Cartilage supports your nose, ears, and ribs. Tendons support and attach your muscles to bone. Ligaments support and hold your bones together. Protection. The skull protects your brain. The vertebral column protects your spine. The rib cage protects your heart and lungs. Movement. Muscles could not function without their attachments to skeletal bones, and muscles are responsible for your movements. Blood formation. Bone marrow in many bones is the major producer of blood cells, including most of those in your immune system. Mineral storage and balance. The skeletal system stores calcium and phosphorus. These are released when your body needs them for other purposes. For example, calcium is needed for muscle contraction, communication between neurons, and blood clotting. And what else? The bones also provide detoxification. Bones remove metals such as lead and radium from your blood, store them, and slowly release them for excretion. So cartilage, Latin for gristle, non-vascular, firm, connective tissue found mostly in joints. Detoxification, removal of poison from a tissue or substance. D is from or out of. Toxic is poison, and then fication is remove. Ligament, Latin for band and sheet, band of fibrous tissue connecting two structures. Muscle, Latin for muscle, tissue consisting of contractile cells. And tendon, Latin for sinew, fibrous band that connects muscle to bone. So did you know bones are divided into 4 classes based on their shape: long, short, flat, and irregular. Bone growth and structure. Bone growth. Factors that affect bone growth include 1. First, genes. Genes determine the size and shape of bones and the ultimate adult height. And 2nd, nutrition. Calcium and phosphorus are needed to develop good bone density. 3rd is exercise. Exercise increases bone density and total bone mass. 4, mineral deposition, calcium and phosphate are taken from plasma and deposited in bone. Fifth, mineral resorption. Calcium and phosphate are released from bone back into the plasma when they are needed elsewhere. For example, calcium is needed for muscle contraction, communication between neurons, and blood clotting. Phosphate is a component of deoxyribonucleic acid, your DNA, and ribonucleic acid, your RNA. 6. Vitamins. Vitamin A activates osteoblasts. Vitamin C is essential for collagen synthesis, and vitamin D stimulates absorption of calcium and phosphate, its transport, and its deposition into bones. And the 7th factor that affects bone growth include your hormones. For example, growth hormone stimulates the epiphyseal plate to calcify, and estrogen and testosterone accelerate bone growth after puberty and maintain bone density. Structure of bones. Long bones are the most common type of bone in the body. Trochanter, condyle, epicondyle, tubercle, proximal epiphysis, metaphysis, diaphysis, the shaft, metaphysis, distal epiphysis. There's articular cartilage, nutrient artery through nutrient foramen. Interesting. God, bodies are crazy awesome. Okay, then your periosteum, endosteum, medullary cavity contains yellow bone marrow in adult. Compact bone and epiphyseal line. Articular cartilage. Femur, long bone on the thigh. Okay, let's see. What else? The shaft of a long bone is called the diaphysis. Each end of the bone is called epiphysis and is expanded to provide extra surface area for the attachment of ligaments and tendons. Sandwiched between the diaphysis and epiphysis is a thin area called the metaphysis. Thin layers of cartilage cells in the epiphyseal plate enable the diaphysis bone shaft to grow in length. When growth stops, compact bone grows into the epiphyseal plate and forms the epiphyseal line. A tough connective tissue sheath called periosteum covers the outer surface of all bones and is attached to the compact or cortical bone by tough collagen fibers. The periosteum protects the bone and anchors blood vessels and nerves to the surface of the bone. The hollow cylinder inside the diaphysis is called the medullary cavity. It contains bone marrow and is lined by a thin membrane called endosteum. The marrow is a fatty tissue that contains blood cells in different stages of development. The endosteum and periosteum contains osteoblasts, cells that produce the matrix of new bone tissue. This process is called osteogenesis. Bone matrix consists of cells, collagen fibers, a gel that supports and suspends the fibers, and calcium phosphate crystals that give bone its hardness. Okay. Bone growth and structure. We have cortex, the outer portion of an organ such as bone, and cortical, adjective pertaining to cortex. And cortex is Latin for bark. Diaphysis. Greek for growing between, the shaft of a long bone. Endosteum, a membrane of tissue lining the inner medullary cavity of a long bone. Epiphysis. Okay, so epi is upon and above, and physis means growth. Expanded area at the proximal and distal ends of a long bone that provides increased surface area for attachment of ligaments and tendons. Epiphyseal plate. Okay. Plate, broad, flat. Okay, a layer of cartilage between epiphysis and metaphysis where bone growth occurs. Haversian canals, also called central canals, named from Clopton Havers, born 1655, died 1702. He was an English physician. Okay, so Haversian canal. Haversian canals, vascular canals in bone. Lacuna, Latin for pit, lake, a small space or cavity within the matrix of bone. Lacunae is plural for lacuna. Marrow, fatty blood-forming tissue in the cavities of long bones. Matrix, Latin for mother, womb, substance that surrounds cells, is manufactured by cells and holds them together. Medulla, Latin for marrow, central portion of a structure surrounded by cortex. Let's see, medullary is adjective pertaining to the medulla. Metaphysis, meta beyond, after, subsequent to, physis growth, region between the diaphysis and the epiphysis where bone growth occurs. Osteoblast is a bone germ cell, bone forming cell. And then osteoclast, a bone removing cell. Osteocyte, a bone maintaining cell. Osteogenesis, creation of new bone. And osteogenics, an adjective for osteogenesis, meaning relating to the creation of new bone. Osteoporosis, condition in which the bones become more porous, brittle, fragile, and are more likely to fracture. Periosteum, strong membrane surrounding a bone, and periosteal is an adjective, so pertaining to the periosteum. Did you know minerals are deposited in bone when the supply is ample and released when they are needed elsewhere? When osteoblasts are incorporated into the new bone, they become osteocytes. These cells, which maintain the matrix, reside in small spaces in the matrix called lacunae. Osteoclasts are produced by the bone marrow. They dissolve calcium, phosphorus, and organic components of the bone matrix. There's a continual balancing act going on as osteoclasts remove matrix and osteoblasts produce matrix. If osteoclasts outperform the osteoblasts, then osteoporosis occurs. All bones are well supplied with blood. The blood vessels travel through the bone in a system of small central Haversian canals. Because of its good blood supply, bone heals. Joints. Classes of joints. Joints allow you to move, but movable parts that rub together can wear out. Damage or disease in a joint can make movement very difficult and painful. The structure of any joint or articulation is directly related to its mobility and function. Joints are classified structurally into three types. First is fibrous. So fibrous joints are two bones tightly bound together by bands of fibrous tissue with no joint space. They come in three varieties. First, sutures occur between the bones of the skull. The two opposing bones have interlocking processions to add stability to the joint. The peristeum on each of the outer and inner surfaces of the two bones is continuous and holds the joint together. Okay, second variety of fibrous joints is syndesmosis. It is a joining of two bones with fibrous ligaments. Their movement is minimal. An example is the joint above the ankle where the tibia and fibula are attached. Let's see, the third variety of fibrous joints are gomphosis are pegs that fit into the sockets and are held in place by fine collagen fibers. Examples are the joints between teeth and their sockets. Okay, second, we have this classification of structural classifications of joints. The second is cartilaginous. So cartilaginous joints join two bones with cartilage. Inside of cartilaginous joints, we have synchondrosis, join two bones with hyaline cartilage, which allows little or no movement between them, as between your ribs and costal cartilages. And B, we have symphysis, join two bones with fibrocartilage. An example is the symphysis pubis, where your two pubic bones meet at the front of your pelvis. Synovial joints contain synovial fluid as lubricant and allow considerable movement. Most joints in the legs and arms are synovial joints. The ends of the bones are covered with hyaline articular cartilage. In some joints, an additional plate of fibrocartilage is located between the two bones. In the knee, this plate is incomplete and is called meniscus. Frontal bone, coronal suture. Oh, this is like the skull. Parietal bone, sagittal suture, lambdoid suture, and occipital bone. Okay, then we have synovial joints. There's your femur, your tibia. Let's see what else. A bursa is an extension of the synovial joint that forms a cushion between structures that otherwise would rub against each other. For example, in the knee joint between the patella tendon and the patellar and tibial bones. Okay, so word analysis and joints. We have articulation, meaning a joint. We have articulate, which is a verb. Joint movement. Articular is pertaining to a joint. The next is bursa, a closed sac containing synovial fluid. And we have fibrocartilage, cartilage containing collagen fibers. Gomphosis, joint formed by a peg and socket. And gomphoses is plural for gomphosis. Gomph means bolt and nail. Hyaline, Greek glass. Cartilage that looks like frosted glass and contains fine collagen fibers. Meniscus, disc of connective tissue, cartilage between the bones of a joint, for example, in the knee joint. Menisci, okay, plural for meniscus, Greek for crescent. Suture, Latin meaning a seam, a place where two bones are joined together by a fibrous band continuous with their peristeum, as in the skull. And sutures is plural for suture. Also means to unite two surfaces by sewing, the material used in the sewing together, and the seam formed by the sewing together. Symphysis, Greek for growing together two bones joined by fibrocartilage. And symphyses is plural for symphysis. Synchondrosis, a rigid articulation joint formed by cartilage. Synchondroses is plural for synchondrosis. Syndesmosis is an articulation, a joint formed by ligaments. Syndesmosis is plural for syndesmosis. Desm, D-E-S-M, the root means bind. And we have synovial. It's pertaining to a synovial fluid and synovial membrane. Syn is together, ov is egg, and al is pertaining to. Okay, we're going to get into joint movement. Joints allow for a variety of actions. Synovial joints provide the greatest range of motion through the body. These joint movements are as follows. Flexion and extension of joints. When standing in anatomic position, every joint except the ankle is in extension. For most of the rest of the body, flexion is movement of a body part anterior to the coronal plane. Extension is movement posterior to the coronal plane. The following figures show flexion, bending, and extension in the elbow, straightening in the elbow joint. Okay, in the wrist joint, the shoulder joint, when you bend your trunk forward, this is flexion. When you bend your trunk backward, that is extension. When you bend your trunk sideways to the right or left, that is called lateral flexion. I actually know these from yoga. Let's see what's going on with that. Okay, so next we'll go to abduction and abduction of joints. Abduction is movement away from the midline. Adduction is movement toward the midline. Abduction of your arm is moving it sideways away from your trunk. Adduction is bringing it back to the side of your trunk. Abduction is your fingers spreading them apart away from middle finger. Adduction is bringing them back together. Medial rotation, lateral rotation, circumduction, pronation, supination, exversion, inversion. Okay. Rotation of joints. Rotation is turning around an axis. Medial rotation of the upper arm bone, the humerus, with the elbow flexed, brings the palm hand toward the body. Lateral rotation moves the palm away from the body. Pronation and supination. When you lie flat on the ground, face down, with your belly and your palms touching the ground, you're prone. When you lie flat on your back, with your spine on the floor and your palms facing up, you're supine. When you rotate your forearm so your palm faces the floor, that's pronation. When you rotate the forearm so your palm is facing upward, that is supination. Circumduction of joints. Circumduction of the shoulder is moving it in a circular movement so that it forms a cone, with the shoulder joint as the apex of the cone. Inversion and eversion. Inversion and eversion. When you turn your ankle so that the sole of your foot faces towards the opposite foot, that is supination or inversion. When you turn your ankle so that the sole of the foot faces laterally away from the other foot, that is pronation or eversion. We've learned abduction, action of moving away from the midline, or abduct is the verb. We had adduction, which is action of moving toward the midline. Adduct is the verb. Ab, away from. Add, toward. Duct is lead. We have a circumduction, circum around, movement of an extremity in a circular motion. Eversion, Latin overturn, a turning outward. And evert is a verb for eversion. Next is extension, Latin to stretch out when a joint is straightened to increase its angle. Flexion is when a joint is bent to decrease its angle. Inversion, turning inward, Latin to turn about. So invert is the verb for inversion. Prone, adjective, Latin prone, lying down, lying face down, flat on your belly is prone. Pronation, the process of laying or lying face down, or of turning a hand or foot with the volar palm or sole surface down. And pronate is the verb. Supine, adjective, Latin supine, lying face up. Lying face up, flat on your spine. Supinate, lying. Okay. Supinate, rotate the forearm so that the surface of the palm faces anteriorly in the anatomical position. Supination, bend backward, is supinate. So process of lying face upward or turning an arm or foot so that the palm or sole is facing up.